All right, everybody, it has been a while since we have done a curbside with a doctor, but here we are. So I wanted to talk with you all about a case that I had that is a little kind of close to the heart. So someone who is in my inner circle of life unfortunately suffered some neck pain. They were doing an overhead movement and kind of had a little bit of a jolt, and that resulted in some pretty severe and pretty intense neck pain that was felt on both sides, but it seemed to lateralize more so to one side, and specifically on the left side. So this patient had to go through insurance in order to be able to get treatments covered and a diagnosis and MRI and things like that, because it happened at their work. So obviously workman's comp and things like that is involved. And this is where I just get really frustrated with the current medical system. So she ends up going and having a CT scan. Well, so she goes to the urgent care because of the intense neck pain, and they order a CT scan. The CT scan comes back pretty much unremarkable, with the exception of some calcification and a little bit of edema and swelling around the longus colli muscle, which is a muscle that actually runs along kind of the front side of the spine. So I ended up taking a look at the imaging, both the report and the hard images, and where the calcification was really high up. It was around the C1 region. So that's basically on the front side, but like basically to get to that area, you know, if you ever had to surgically or for injections, you actually have to go through the mouth. So it is insanely high up there. And so, you know, so she goes and she meets with the spine surgeon, and the spine surgeon does not have the images because there were some technical errors that happened with the imaging, and all he has is the report. So he looks at the report and says, oh, you know, they said that this is likely a tear in longus colli. It's probably not. It's just inflammation and swelling. Doesn't even do any form of physical exam on her. He didn't touch her. He didn't do range of motion, like look down, look up, none of that type of stuff. He simply just said, okay, physical therapy, and we'll see you in 2 months. Nothing. And it is not to his fault. I say that, I don't say that lightly. The system is set up in such a way that he knows that he has to go through physical therapy because that's what the insurance is going to dictate. And that's the punchline of this whole talk that I'm giving here, is that everything gets dictated by insurance in situations like this. But okay, he still could have done a physical exam on her. He still could have made her feel like her pain was important, but she walked out of there thinking that he doesn't give a crap about my pain. It's just checking off the box and going on to the next person, because that's the way it is. They don't have time, they're not getting paid enough, whatever. And it was really discouraging for her as she was kind of going through this. And so I end up, as I previously mentioned, taking a look at the imaging. Also got to do, you know, a basic physical exam on her. And I say basic because her pain is so intense that I really can't do much, right? Really restricted passive and active range of motion, a lot of muscular guarding, and a lot of things were tentative palpation. But one of the things that I saw continually a lot in my residency, and because we dealt with a lot more acute pain patients there than I do in private practice, was Facet syndrome. And her presentation was close enough to Facet syndrome for what she had, which was, even though she had restrictions in all ranges of motion, looking up was the absolute worst for her. Looking down provided her a tiny bit of relief, although she still had quite a bit of pain and couldn't go very far. And then the other thing was severe tenderness over the paraspinal muscle, so the erector spinae muscle group, over top of what's called the articular pillar. That articular pillar is where the facet joints are, as you have your inferior articular process, your lamina, and then your superior articular process, and those are in succession. That creates the articular pillar, and those are where the facet joints are going to be found. So severe tenderness palpation over the left side, which was the worst side for her. And so, you know, I talked with her and said, hey, you know, it's possible that the longus colli calcification and edema could be a very clinically relevant thing. It's really hard to know right now because we can't do a proper physical exam on you. But one thing I do know is that there is more than likely some facet-mediated pain with this. Whether it's the only thing, whether it's part of the thing, I had a good suspicion that that was part of it. So what do we do? Well, I really wanted to know to what degree that this was the case. And so we decided to do what's called medial branch blocks. So we block the medial branch, which is a branch off of the dorsal rami that wraps around the actual lamina, and then it's going to innervate the facet joint. So anybody who has had or knows somebody who has had a radiofrequency ablation for the spine, whether that's in the neck, the thoracic spine, the low back, it is almost always that nerve that is getting burned, the medial branch, which because it innervates the facet joint. So we did a really, really low volume of just an anesthetic around the medial branch where that is wrapping around the lamina in order to see if we could create some change in her pain for a temporary period of time such that we would be able to determine how much of this pain can be from the facet joints. So we did that, and we did a short and a long acting anesthetic. So we predicted about 12 hours relief immediately after. So initially we just treated C2-3, 3-4, and 4-5 because it seemed like most of her pain was in the upper. So we do that, immediately getting off the table, she already reports that she's 80% better. And so that's gonna be from the short-acting lidocaine that we use in the injection. So already we know that, hey, there's a huge portion of this pain that is related to the facet joints, and maybe even I mean, at 80%, a huge significant portion related to the facet joints. So from there, we waited a few days to see what would happen. The next day, talk with her. So now it's been about 24 hours, and some of the anesthetic has definitely worn off, but she is still about 30% better, 20 to 30% better. She has more range of motion. It is nowhere near the amount of guarding that she had before. And so we actually saw a positive therapeutic response as well. Now, side tangent, this is sometimes, we see this relatively often where when we have patients in really extreme or really acute pain, just shutting down the sensation, the danger signals from the tissue to the brain helps a lot of the time actually reduce the amount of signals that end up coming after the fact. And we are kind of desensitizing the brain to the danger signals such that we are helping to reduce the actual pain, even though all we did was temporarily block it, and then that pain signals come back online. But we see that we actually can sometimes get a therapeutic response to that. So we let that kind of cook for the next few days with her to see how she did. She was still seeing some continued improvements, but then she ended up having, it kind of migrated a little bit to her lower facet joints. Very similar presentations before, tenderness, palpation over the articular pillar, all that type of stuff. So what did we do? We repeated. So we then did medial branch blocks basically for the entire left-sided articular pillar. So we did a C2-3 all the way down through C7-T1. Again, she gets up off the table and she's 80–90% better. And that was about a week ago now. And to this point, she is still about 50% better, and she has much more range of motion and much less scarring. And so for us, what we're going to do is we're going to continue supportive care until it's time for us to go in with some PRP injections to help heal the little bit of damage and inflammation that occurred from that injury that she had when she was working overhead. Now, mind you, in this entire time, and this part also pisses me off, in this entire time, she has still not been able to get physical therapy set up through her insurance provider. So if I was not in her circle, she would have continued to be in 8, 9 out of 10 pain where she couldn't work. Activities of daily living were extremely difficult, and she just would have been waiting for the people at her work in the HR department, waiting for the physical therapy office, waiting for the surgeon's office to coordinate everything that was needed in order to actually get her into physical therapy. Mind you, her pain probably would have improved a little bit over, this kind of past 2-week period. That is generally how things happen, is that pain does get better as time goes on, but more than likely not to the degree that we've been able to have an impactful change with the medial branch block. So very glad to have been in her circle and been given the opportunity to help her, but it just breaks my heart that this is happening all the time across the country where patients are in pain. And if we didn't have these shackles on us in terms of that the patient has to do physical therapy before any injections are done, then I mean, it just, this patient, if proper care was done, it would have been, you go in, you get a physical exam and imaging, and the physical exam is good enough to determine that medial branch blocks would be the most appropriate first step, not physical therapy. And that's nothing against physical therapists, but when you have a severely hot facet joint, you want to calm that facet joint down first. If a patient can't move more than this, I mean, yes, there are passive things that can be done in physical therapy, but in my opinion, getting in there with a little bit of local anesthetic can make a huge, huge difference in helping to heal this. And so that should have been the appropriate steps for this patient. Physical exam, imaging to rule out the big scary stuff because her pain was so intense, and then targeted medial branch blocks to actually address the cause of why she's in acute pain, and then work on the underlying mechanics for this not happening in the future, which is where physical therapy comes into play. So that is my curbside with the doctor rant. I hope y'all enjoyed it. I'm gonna try and get back to doing more of these, and I hope you all have a wonderful day whenever you are seeing this. And everybody who is suffering chronic pain, please, please do not give up. Love you all.